Hello, my name is Jadea, and I am a graduate student in the Masters of Criminology program. And for today, I'm going to be presenting on the research I conducted with Professor Dr. Yetter last semester, where we focused on interviewing domestic violence advocates throughout the COVID-19 pandemic. So just a little bit about the different advocates we focused on. We focused on researching advocates from New Hampshire, Massachusetts, and Rhode Island. Overall, we had 12 participants that agreed to participate. We contacted them through phone and email, and this was some of just the list of different organizations that we contacted, the amount of them. And so again, 12 of them agreed to participate, and we were contacting them through sending recruitment emails and also by contacting them with cold calling and just telling them a little bit about our research project and how we really wanted to know how domestic violence advocates were impacted by COVID, how they were practicing self-care, and how this impacted, the organization itself. So to gather the data for this research, we conducted in-depth semi-structured interviews. And what's really important about in-depth semi-structured interviews is they're almost open-ended questions that really leads to reveal how the advocate truly feels about the topic. So even though I asked these list of questions here, sometimes they led to other questions, and sometimes they would open up about questions that I didn't even ask about because a lot of these questions were very personal and it was anonymous. So people were really able to share how they truly feel. So the three questions we really focused on was how COVID impacted the organizations, the survivors they served, and then the advocates themselves. And we really also wanted to know what they practiced for self-care. And I'll share at the end of my presentation a little bit about some of the forms of self-care that they practice. It won't be a little shocking. It'll be similar forms of self-care that we all practice, but I just think it's really important to share. So for some of the results that we found for the organization itself, we found that a lot of the organizations had a lot of turnover and a lot of layoffs, especially when the pandemic, this affected a lot of nonprofit DV organizations. So a lot of employees were leaving, because of COVID itself. There were budget cuts, so a lot of people had to be laid off. A lot of departments were cut down. So this really impacted a lot of organizations to continue giving out the services that they gave before, with full staff. So it made it very difficult for organizations. There was a lot of funding issues, although there were so many, different grants and different funding that was out in the beginning of the pandemic for hotels. That money quickly runs out. Just making sure that one survivor in a hotel has, food and, all these different things in the hotel and the actual hotel stay itself, to cover for months was extremely expensive. So a lot of organizations were searching for funding, and it still sometimes felt like it was not enough. Domestic violence rates did increase during the pandemic. Domestic violence rates were already high before the pandemic, but after the pandemic, they increased a lot because of the stay-at-home order. A lot of survivors were forced to stay at home with their abusers. This also caused a lot for the organizations because the DV rates were rising so high, and organizations did not have enough services or beds to assist all the survivors that that really needed help. So it was really difficult. A lot of people weren't able to access services that they really needed. Also, organizations had to transition to remote services, which was also difficult too, because remote services, there was mixed emotions about it because it made it more accessible to be able to, reach survivors that didn't they didn't have to drive there anymore, and they didn't have to find childcare to go access the services and different things like that. But it also put them in a really great risk, because a lot of them were living with their abuser, and they would access the services sometimes when they were going to work, when they would say what they're going to an appointment, or when their abuser was at work. So with the stay-at-home order, they were required to stay at home all the time. It was really difficult trying, to have therapy and different things like that remote. It was also really difficult to follow CDC guidelines. I remember I spoke to one organization that had a full shelter that fit about 6 to 8 beds. And because of CDC guidelines, they were only able to keep one survivor in the shelter at all times. And when people would call asking for beds, they would have to say that they're at full capacity because of CDC guidelines. It's very hard because a lot of the times shelters are like their homes that survivors can live in, about to, up to 8 survivors can live in. So it's really hard to maintain that 6 feet apart and ensure that COVID is not being spread in the shelter. Another thing we found is survivors were moved to shelters, and they were moved to hotels. This was a lot on the survivors themselves, because, they had to continue to be relocated. There was a lack of housing already before COVID. And then when COVID hit, there was really a lack of housing for survivors. So there's a big housing crisis. And we saw that throughout all the 3 states that we focused on. It was really hard to maintain confidentiality in the hotel. Hotel staff had to be trained on how to treat the survivors of domestic violence, but still in itself, it was really hard to maintain that confidentiality, versus if they were in the shelter, it'd be in a secure location, where the public population is not allowed. So they were placed in a public place. So, their safety was at risk. And it could be very isolating in the shelter and the hotels. So like I said, some were able to stay in the shelter based on different organizations, but some were placed in hotels because, sometimes there was a COVID outbreak and they all had to be moved to hotels, or sometimes the shelter couldn't follow the CDC guidelines, and there just wasn't enough space. So they had to place all their participants in hotels. So it can be very isolating. You can't leave the hotel room. You have to stay there, especially with the COVID, and it almost feels like a never-ending quarantine. And again, it's important to note this is hard on survivors of domestic violence. They were isolated by their abuser, and then to be placed in another setting and a pandemic can feel isolating again, and can be very traumatic for survivors. There no longer was in-person advocacy support and court therapy and with law enforcement, because all services were remote. For example, in the past, if you had to file a restraining order against your abuser, you could have a court advocate right next to you in court, and then your abuser would be on the other side of the courtroom. Versus if you're all on Zoom, it can kind of be intimidating because your abuser is right in front of you and your advocate is there, but they're not right next to you. So it's really difficult trying to offer support during this pandemic to survivors, especially with situations like this. Like I said earlier, survivors were living with their abusers, so it's harder to access organizations' services. And there were no beds available. I remember I was working in this field. I work for a violence response team, and every time I had a DV survivor, I would call everywhere, even states nearby, and there were no beds available. And this was, August, September, that I couldn't find any beds. So it's just been extremely difficult. Even now that the pandemic's starting to die down, I still have trouble finding beds for survivors, because there's just not enough. Also, advocates reported feeling like they weren't doing enough. They were limited on what they could do. It was hard to provide services. They felt extremely burnt out, especially when they were working from home. It was difficult to turn off work and really set boundaries. It was hard for them to build relationships remotely. I know, working in this field, trying to talk to a survivor that does not trust you and has faced extreme forms of trauma, it takes a long time to build that relationship remotely. You're not able to read body language like you would in person. And sometimes, especially if it's over the phone, you don't even know what this person looks like, and you have to trust them, to help them. Um, you have to trust them to help you. So it is a lot. They faced a lot of technology challenges, trying to get documents to the court and trying to ensure that survivors had the access to access their services. A lot of the times you can't just assume someone has a computer, to join a telehealth session for counseling and different things like that. So that was really difficult on advocates. They just talked about how they felt really burnt out. A lot of these advocates didn't even take vacations this entire pandemic, that they're just now taking a vacation a year later. So they've just been really overworked, and they've been dealing with their own personal trauma. So they faced a lot of secondary trauma. A lot of the people who work in this work are survivors themselves. So they do this work because they're very passionate about it. I always say we don't do this work to make $1 million. A lot of the advocates who do this work are truly dedicated to this work. They're either survivors themselves, or they have someone close to them that has been impacted by this trauma, and they're really dedicated to this work. So to go through your own secondary trauma, and then to go through, the feeling of how COVID has impacted people, it impacted people a lot mentally and physically. So it was a lot on advocates, dealing with their own personal trauma and still trying to provide, adequate services to survivors. So these are just some self-care methods that advocates shared. I think it's important to note that it's very similar to the self-care options that a lot of us practice, that are, a lot of people practice that are not in the trauma field. I think a lot of the times when people think you're in the trauma field and you work with such intense cases, that you have to have these amazing forms of self-care and you have to practice all these different things. But it's really similar forms of self-care that a lot of different people practice in different fields. And they did mention, like, the most important thing was support from their coworkers. So it was really hard because they had to change, the self-care that they practiced before the pandemic, that they got so used to in this field, maintaining, maintaining their mental health. So they really had to change that. Support from coworkers no longer looked like, in the office, just talking to your colleague and really debriefing about an intense domestic violence case you had. You now sometimes could bring it up in the meeting a little bit, or you had to call your colleagues. So it was very difficult because colleagues were dealing with their own trauma. So it was really hard, still staying active and still trying to keep going through the pandemic. So I really appreciate for everyone listening to my presentation. I just wanted to leave my contact information just in case if anyone had any questions, or if they were interested in this field of domestic violence. I would love to chat more if you have any more questions. My email is listed here. And like I said, I really appreciate everyone for joining. And I hope everyone has a great day.